So good morning all. We have completed regarding cardiac assessment. So next now we will start with the diagnostic procedures of cardiac disorders. Okay. Now when I tell regarding the diagnostic procedures of cardiac disorders, there will be a certain procedures which are done to diagnose the cardiac disorders. Okay. Now if I ask you what are the diagnostic procedures, first of all you may just tell about ECG, or you may also tell about chest x-ray or CT scan, MRI. Okay, along with that we have got lot of other important diagnostic measures which are used to diagnose the cardiac conditions. Okay, so we are studying here in detail regarding each one of it. Okay, so when we come to the cardiac disorders, I may not be explaining those. I'll be explaining regarding each of this diagnostic procedures right now. And you should also know that the diagnostic procedures of cardiac disorders are very, very important. They have been asked for 2 marks or even for 5 marks. Okay. So, as I am dealing regarding each topic, I will tell you which is very important. Okay. So, before starting with the important diagnostic procedures, we'll start with the simplest diagnostic procedures, that is blood investigations. Okay. So all of you are aware regarding the blood test, isn't it? There are a lot of blood tests which can be done to diagnose the cardiac disorders. Now, particularly when we see the cardiac diseases, we have a gold standard procedure, okay, especially when a person is having myocardial infarction, that is MI or heart attack. In that case, to diagnose if it is an MI or a heart attack, we have a particular type of a diagnostic blood test. Okay, it is a gold standard blood test we can tell, and that is cardiac enzymes or cardiac marker. Okay, so it is asked for 5 marks. Okay, or sometimes even for the viva it can be asked. Now, what do you mean by cardiac enzymes or cardiac markers? So, as the name suggests, cardiac enzymes, they are the enzymes which are usually released only when there is damage to the heart. Okay, so certain proteins will be released into the bloodstream whenever there is damage to the myocardium. Okay, so we know when there is a MI or when there is heart attack, what happens? There is damage to the myocardium, and that time what happens is there will be release of certain enzymes. Okay, so these are nothing but certain proteins. Okay, so these cardiac enzymes or cardiac markers will be only present in the blood for some period of time. So each type of a cardiac enzyme is present for a certain duration of time. Some are only present for 7 hours, some may be present for only 24 hours, some may be present for at least 36 hours. So it is very essential that you will do the blood test immediately. Suppose a person has got a heart attack, minor or a major one, and they are visiting after 3-4 days. Okay, in that case this cardiac enzymes may not be detected in the blood. Okay, so immediately when there is a damage to the heart or when there is damage to the myocardium, what happens? Okay, that time there will be release of certain enzymes or certain proteins. Okay, so these enzymes or proteins are circulated into the blood. They are referred as cardiac markers or cardiac enzymes. Okay, now we have learned the definition of cardiac enzymes. Now there are so many types of cardiac enzymes. Okay, not only one cardiac enzyme is there, we have got nearly 5 cardiac enzymes. Okay, so the cardiac enzymes are creatinine kinase, troponin, myoglobin, LDH, that is lactate dehydrogenase, SGOT, which is also called as AST. Okay, AST full form is aspartate amino transferase, and SGOT full form is serum glutamic oxaloacetic transaminase. Okay, so these are the 5 cardiac enzymes that are usually released into the blood when there is myocardial cell damage, especially during a heart attack. Okay, now we should remember that the first 3 are normally can be told as a told as cardiac enzymes. Presently, LDH and SGOT are not considered as cardiac markers. Okay, why? What is the reason they are not considered as cardiac markers? Because it is told that whenever there is damage to any body part, okay, whenever there is damage to any body part, that is maybe muscles or brain or liver or any organs, whenever there is damage to any of these parts, there is rise in LDH and SGOT. Okay, so we cannot consider it as cardiac marker, but when there is inflammation in the body, these enzymes are released. Okay, so remember, presently LDH and SGOT is not considered as cardiac marker, but they are released into the bloodstream when there is any injury to the body. Okay, so we don't know whether the injury is related to the damage to myocardium or damage to some other part. We cannot understand the difference. Okay, so that is why now presently LDH and SGOT is not considered to be cardiac marker, but creatinine kinase, troponin and myoglobin is considered as cardiac marker. Okay. Now in detail we will see regarding this all these things. Okay. So first of all we will see regarding creatinine kinase. Okay. So creatinine kinase also is seen not only in the heart muscle, it is also seen in the skeletal muscle and brain. Okay. But particularly CKMB. Okay, we have got CKMB, that is only cardiac specific. Okay, I'll tell you why it is the reason. Now, I told that creatinine kinase is found in the skeletal muscle also, in the heart muscle also, in the brain tissue also. Okay, now CKMM means it is found in the skeletal muscle. CKBB is seen in the brain. Okay, creatinine kinase enzyme that is seen in the brain is CKBB. Now, the creatinine kinase enzyme, which is seen when there is damage to the myocardium, that is CKMB. Okay, so always remember in in creatinine kinase, which is cardiac specific enzyme, that is CKMB. Okay, remember only CKMB is considered to be cardiac specific. Okay, so CKMB will be usually released into the blood circulation whenever there is damage to the myocardium or whenever there is any heart attack. Usually there will be release of this CKMB. Now the speciality of the CKMB is usually this CKMB will rise immediately within 4 to 6 hours. So immediately you have got myocardium damage or immediately after a heart attack, within 4 to 6 hours it will start to rise. It will be in its peak. Peak means it will be increased in 18 to 24 hours. Okay, and then it will come slowly down within 2 to 3 days. Okay, so that is why I told, if you go to the hospital for blood checkup after 2 to 3 days, you will not even find CKMB. Okay, because already the levels have come down. Okay, so remember, creatinine kinase is found in the brain, heart and even in the skeletal muscle, but which is cardiac specific, that is CKMB. It rises from 4 to 6 hours, it peaks in 18 to 24 hours and returns to normal. It will decrease in 3 days. The normal value of CKMB is 0 to 9 units per liter. Now it's okay if you don't remember the normal value, it's all right. Okay. Then you should always remember that whenever a person with the any cardiac condition is admitted, especially with MI, blood samples will be taken immediately once they have come. Okay, so soon after admission they will take the blood samples, maybe in the emergency ward, and every 12 hours or every 24 hours they will be collecting the blood. Okay, to see whether these cardiac markers are increased or they have decreased, to know regarding that. Okay, not only with creatinine kinase, with the in any cardiac enzyme, usually they will test. Okay, where they will frequently come for the blood checkup. Okay, so that is regarding CKMB. Now next is regarding troponin. So troponin is also a cardiac enzyme which is cardiac specific. Okay, now Here also, whenever there is damage to the myocardium or whenever there is damage to the heart, what happens is there is release of the enzyme troponin. So in troponin, there are two forms. Okay, there are two forms of troponin. First one is cardiac specific troponin. Next one is cardiac specific troponin I. Okay, so troponin T is there and I is there. Okay, first one is, we call it as trop T. One more we call it as trop I. Okay, so cardiac specific troponin T, cardiac specific troponin I. So these are the two we can tell types of troponin. So the speciality of this troponin is, immediately once you have got myocardium damage or whenever there is MI, within 1 hour it will rise. It will start to rise. Okay. And it will be in peak in 12 hours, and after 12 hours it will come down. Okay. So you can see how much fast troponin levels will come down. Within 12 hours it will come to normal. After 12 hours it will come to normal. So what you have to do immediately, once you have got the chest pain or you feel it is a heart attack, you have to check for this troponin levels. Okay, so troponin levels will usually rise when there is any myocardial cell damage. So the normal level of trop T is less than 0.1 nanogram per ml, and trop I normal level is less than 0.4 nanogram per ml. Okay, so you need not try to remember the normal values. You can remember the other explanations. The next cardiac marker is myoglobin. Now myoglobin is also a type of a protein or an enzyme which will release whenever there is any myocardium or cardiac cell damage. Okay, or sometimes even when muscle damage is there, myoglobin can be released. Myo means muscle, isn't it? So it is seen that myoglobin is usually released into the bloodstream within half an hour to 1 hour after heart attack. Okay, so within half an hour to 1 hour after the injury, this myoglobin is released, and it will start to reduce immediately. Okay, so it will become normal within 7 hours. It will decline, continue, it will become less. Okay, within 7 hours it will reduce. So that is why again it is very essential to perform myoglobin also. Okay, so it will rise within 30 minutes to 1 hour, but within 7 hours it will come down. Okay, so the normal level of myoglobin is less than 92 nanograms per ml in men and less than 76 nanograms per ml in women. Okay, so that is regarding the next cardiac marker. Next one is LDH. I told it is not a cardiac marker, okay, but we will see something regarding LDH. Now LDH full form is lactate dehydrogenase. It is having 5 isoenzymes, okay, that is 5 subtypes are there in LDH, that is LDH1, LDH2, LDH3, LDH4 and LDH5. Now in these 5 subtypes of LDH, only LDH1 and LDH2 is cardiac specific. Okay, only LDH1 and LDH2 is cardiac specific, and it is noted that the LDH levels will be seen within 48 hours after any myocardial infarction. So within 48 hours of heart attack, the levels of LDH will usually rise. But it is also seen that the LDH levels will remain high when a person is having any damage in the body. Okay, whenever there is inflammation anywhere in the body, LDH level will rise. Or if a person is having cancer or hemolysis, that is breakdown of the RBCs, that time also LDH levels will rise. So that is why I told, particularly presently, LDH is not considered to be cardiac specific. Okay, only LDH 1 and 2 is cardiac specific. Next one is AST, aspartate aminotransferase. Now it was used earlier, this STOT, also called as STOT, it was used earlier, but presently since it is not cardiac specific, we are not particularly using. But this AST level or ALT level, okay, this we are using in the case of liver function test, especially when a person is having liver cirrhosis and all, we will perform liver function test. That time we will do that. Okay. Next is moving on to serum lipids. You know, serum lipids also play a very major role in cardiac diseases, because as the level of cholesterol increases, okay, when the level of cholesterol or lipids is increasing, what will happen? Fat deposition will happen. So because of that hyperlipidemia, okay, what will happen? Increased risk of coronary artery disease. There is increased risk of not only CAD but MI and any other cardiac condition. Okay, so that is why monitoring the lipid levels is very, very essential. Okay, commonly they will check the blood levels of triglycerides, cholesterol level, okay, or lipoprotein, that is HDL, LDL levels may be checked, or even the ratio of HDL and LDL may be checked. Okay, so remember that usually under the serum lipids, triglycerides, cholesterol and lipoprotein levels will be usually monitored. Now moving on to cholesterol, we know cholesterol is a blood lipid. Okay, and when there is elevated cholesterol, it shows that person is at increased risk of cardiovascular diseases, or person is at risk of coronary artery disease, which is called as atherosclerosis. Okay, in atherosclerosis, that there is fat deposition or atheroma deposition. Okay, we'll come to that in the next classes. Now, this cholesterol levels are usually checked in the fasting levels. We call it as FLP, fasting lipid profile. Okay, so if they advise for FLP, fasting lipid profile, they will check the cholesterol level, HDL level, LDL, everything. A person has to be fasting. That is, after 12 midnight, they will be fasting. They should not have breakfast before doing the blood test. Okay, and the normal cholesterol levels is very, very important. They can ask you, it has to be less than 200 mg per dl. Okay, cholesterol should be always less than 200 mg per dl. Next is triglyceride. Now, triglyceride is also a mixture of fatty acid. Okay, and when the triglyceride levels are increased, the risk of developing cardiovascular diseases also increases. The normal value of triglyceride is 40 to 190 mg per dl. It can vary slightly with age, alright, but remember it is less than 190 mg per dl. That is regarding triglycerides. Okay. Next, moving on to the lipoproteins, we have got LDL and HDL. Okay, high density lipoprotein and low density lipoprotein, and very low density lipoprotein is also there. Now, LDL is considered to be a bad cholesterol, while HDL is considered to be a good cholesterol. Okay, so the level of LDL should not be excess because it is considered to be bad cholesterol. Okay, now this is regarding the mainly regarding this lipid profile. Okay, and also you should know that when they are checking LDL HDL level, they will also see the ratio of LDL and HDL. Okay, so ratio should not be very much high. Okay, that is also necessary. Next one is homocysteine. Now regarding homocysteine, I don't think you might have heard. Okay, so what is a homocysteine? Homocysteine is actually an amino acid that is produced because of the breakdown of protein. Okay, and it is seen that through research they have found out that when there is excess homocysteine in the blood, okay, when there is excess homocysteine in the blood, there is increased risk of cardiovascular disease, because it is told that this homocysteine will damage the endothelium. Endothelium is like a protective barrier for the arteries, okay, endothelium. But this homocysteine will damage the endothelium. Okay, so what will happen when the endothelium is damaged? It will result in a thrombus or clot. We know when clot formation happens, a thrombus will happen. It can result in a moving clot and it can get dislodged anywhere in the body. Okay, so remember, this homocysteine levels are high. What will happen? It will damage the endothelium and also it may result in thrombus formation. Okay, so homocysteine is nothing but a protein that is produced because of the breakdown. Okay, and increased homocysteine will increase the level of cardiovascular diseases. Okay, now here are some food products which will reduce the homocysteine level. Okay, not increase, they reduce the homocysteine level. For example, more spinach, turnip. Okay, then eggs are also quite good, but not too much. Asparagus, black-eyed chickpeas, fruits, raw nuts, garlic, turmeric, broccoli, regular exercise, and organic brown rice. Okay, they help to reduce the homocysteine levels. Okay, so that is regarding the blood investigations.